Thank you very much, and thank you very much, everybody in the room. Thank you for coming, and thank you to our distinguished panelists who are here. You are very welcome. These are health workers, and like the keynote speaker said, these are the people who wear the shoes, and they know where it hurts. They represent health workers from all over the world. They have experience, they have saved lives, they were working during the pandemic, and we really, really appreciate them. So thank you for coming, our dear panelists. Can we clap for them, please? But let me say clapping is not enough. They are saying enough is enough. They need to be paid and be well remunerated. And so I'll start off the questions with Rashid. Rashid, yeah. Rashid is from Malawi. He's a nurse from Malawi, and he does tremendous work in Malawi. He has been doing this for a while. And I'll ask all of you the same question. Rashid, we are about 2.5 years into the pandemic, the COVID-19 pandemic. And during that time, there has been significant new investments to fight the pandemic and much admiration and applause for you health workers. So would like to know, thinking back over the pandemic, what are the 2 or 3 ways your professional life of those of your colleagues has changed or has not changed? Over to you, Rashid.
Thank you so much, Esther, for the question. I'll say how COVID-19 pandemic has changed me personally. I used to be a nurse who wakes up each and every day, go to work and provide daily patient care. Then the next day, do the same. After COVID came, that changed to be a nurse leader and an advocate who has made it today to be here in the US at this very important event. So without COVID-19, I would say I would not made it to this very important event. For your information, I would like to say that this is my first time to travel outside my country, and this is my first time to be on the plane. So you can surely understand how historic and important this event is to me. So it all started when we had our first case in my district, where everyone else was afraid in taking care of patients with COVID-19. So I had a colleague who had COVID-19, and he developed into severe illness of COVID-19, but at that moment, we had no treatment center, we had no resources, we had no oxygen, we had no everything that we could use to take care of COVID-19 patients, but then we had a patient, and we didn't know what else to do to save this patient. Every healthcare worker was afraid. No one volunteered to go to the treatment center to take care of this patient. I did, only me, volunteered to take care of this patient with my other colleague. There was no clinicians, there was no doctor. It was only me and my other nurse, my fellow nurse, who was taking care of this patient. All we could do is because we had no knowledge of COVID, how to manage COVID-19. You know, back then, no one had enough knowledge of managing COVID-19 cases. So all we could do is to monitor until we lost the patient. So it was sad because at some point when this patient was saturating at about 20%, he asked me, isn't there anything more you can do to save me? So you can imagine. Yeah, so that picture still stuck with me up to date, and that's what motivated me to do advocacy activities in the community. I've been a focal person nurse in Malawi, and also COVID-19 vaccine advocate. In addition to that, I've done a lot of community initiatives in COVID-19. So in a nutshell, that's what I can say how COVID-19 pandemic has changed me. Yeah, and then there has been a lot of challenges that we've been facing as healthcare workers. We are working in fear in Malawi, the fear of contracting COVID-19 because we do not have enough personal protective equipment to use, and also the fear of being harassed by the community because of COVID-19. When COVID-19 came, it came with a lot of disinformation and misinformation. So a lot of people now, they don't trust healthcare workers, in the community because they think we are harming them. Imagine you're a male healthcare worker, you have traveled more than 40 kilometers to hard to reach area in order to provide routine immunization to the community. And then the people in the community, they lock you up into a room and they tell you to vaccinate yourself first for them to trust you that the vaccine that you've brought to them is safe. So you can imagine a male healthcare worker getting HPV vaccine, which is meant for women. Yeah, we're also living in fear where community health workers are chased at an outreach site, where they've brought SRH services and the routine immunization, but the people in the community, they don't trust. Yeah, they think it's COVID vaccine. The services that they brought are not SRH or routine immunization, but rather COVID-19 vaccines. And a lot of people, healthcare workers, are being chased in the communities because of COVID-19 vaccines. There are a lot of things that are happening in my community. I think because of time, I'll let my colleagues to continue from there.
Thank you, Rashid, and it's great that you have become a vaccine advocate in your country. And Bupe is from Zambia, and she represents Mothers to Mothers. And Bupe, I'll ask the same question, thinking back over the pandemic, what are the 2 or 3 ways your professional life or those of your colleagues has or has not changed?
Thank you so much for that question, and good afternoon, everyone. I guess it's still good afternoon. I'm also still getting used to the time difference. Like I've been introduced, I'm all the way from Zambia. I'm a community health worker known as a mentor mother, and I work for Mothers to Mothers. So I'll give 3 examples of how COVID changed our lives on a professional side. So one example I'll give is how it's changed slightly. It's something we've been doing, but when COVID-19 broke, we increased our use of technology. Community mentor mothers like myself, we've been using digital tools for years now. But when the pandemic increased, we increased the use of our technology, but not taking it away from our in-service interactions, because that's what makes Mothers to Mothers. We go door to door in these communities and make sure we have that interaction and create that relationship. That's what helps us connect and know what our communities need. So that's changed slightly. We were using digital tools, but we just increased that when COVID-19 broke. Then the other thing, the example I'll give is what has not changed. What has not changed is the need to double efforts to make sure people are connected to healthcare services they need and leaving no one behind. What this means is when we go in communities, we make sure we are seeing the entire family, so meaning from the mother to the children and to the partner. So we really need to make sure that we are evolving and becoming a primary healthcare organization. And the use of technology also helped us reach 200,000 clients through a peer support by phone alone. So that is what I can say changed.
Okay.
The other thing, just one more.
Okay.
Okay. So the other thing, sorry, that has not changed is how we community health workers are not being paid. All community health workers everywhere are not being paid enough, and this has to change and is unacceptable. So until community health workers everywhere are paid and are formally recognized, we are only paying lip service to our profession. Thank you.
Thank you, Bupe, and I think everybody in the room is hearing you loud and clear. And Daren from Philippines. Daren is from the Philippines, and I'll ask you the same question about the pandemic and what are the 2 or 3 ways your professional life or that of your colleagues has changed.
Thank you, Esther. First and foremost, I would like to say thank you for, it's an honor and a privilege to be part of this panel. So I am speaking on behalf of the young health nurses who are in the front lines during the pandemic in the Philippines. So just to give you a little bit of background, Philippines is quite famous for producing world-class nurses and sharing them to the world. I'm pretty sure I can see a lot of nod here. You've met a Filipino nurse in one of the hospital or clinic here, am I right? Or probably in other states, right? So we are famous for that. I guess in 2 reasons. Most of the Filipino nurses are migrating and moving into another country to look for better opportunities because of 2 reasons. The first one is in the Philippines, nurses have poor salary and lack of benefits, to be honest with you. And I remember, one of my colleagues saying that, how can you survive with $200 per month? And just to give you a context, the estimated living costs in the Philippines, predominantly in the capital, Manila, would be around 1,000 per month. But the basic salary of a private health nurse, a nurse working in a private hospital is $200. So can you survive with $200? Tell me. Then the second one is the nurse and patient ratio. So we do have an optimal ratio around 1:4, 1:5 if you're in a medical surgical ward. But guess what in the Philippines? What's the ratio? It's 15:20 per nurse. So those are the 2 main reasons. So pre-pandemic, there's already a nursing crisis in the Philippines. But during the early stages of the pandemic, a lot of things also came in. So there have been an inconsistent supply of personal protective equipment, PPEs. We've come to a point that we're reusing masks. Side A, side B. Can you imagine? I'm looking at you. Can you do that? Sorry, I'm laughing, but I am frustrated. I am really frustrated. And then, but there's also a good thing that happened, during the pandemic. After 1 year battling with the COVID-19 pandemic, our government stand up. There has been a legislation to provide more compensation, more benefits. We were given $10 on a daily allowance if you're taking care of a COVID-19 patient. That's number 1. Second one, we were given a hazard pay. And then the third is we were given a meal allowance. But that's only that. And it took months for them to get paid out. We have to wait like almost at the end of 2021 just to get those benefits. So, our working condition is, I'm looking for a term on how to describe it. It's inhumane. I feel that I am a domestic captive of my own country. I cannot even go out because of those. There's an invisible barrier that I cannot even go out. Before I end this one, I want to share to you one of the things that my nurse colleague told me during the most difficult part of the COVID-19 pandemic, when we had the most number of cases. My colleague said, "I don't feel cared for. I feel super exhausted. But I always have to keep in mind that I have this responsibility to help our people because no one else will." Thank you.
Thank you, Daren. That's really touching from your friend, and we know that you're saving lives. And Amy, you're based here in New York, and you've had all these experiences from your colleagues. What do you have to say about the pandemic? 2-3 ways do you want to say?
Good morning, New York. You guys can call me Nurse Amy. I live here. This is my home. Let me be the first to welcome you here and also to thank you. One thing that I learned during the pandemic is that there's not a front line without the second line and the third line and all the lines behind that. And I know that a lot of you here today are involved in that. And I don't think that there's ever going to be a thank you that's big enough to thank you for all of that. So I really appreciate it. I also learned during this pandemic that a lot of us attach who we are to what we do. Things that changed in the hospital, we learned that it's not ventilators and supplies that make an ICU setting. It's not beds that make a hospital, right? It's the nurses. And you can make an ICU out of literally anything as long as you have the proper training for your nurses. I'm very lucky to work at a very nurse-driven hospital. I work up at NewYork-Presbyterian, Weill, Cornell, and our ICU nurses actually held a crash course for those of us who don't work in those critical areas to teach us how to care for these really, really sick patients. We also had a lot of support from our leadership team. I know we don't think of New York City as a community, but I promise you that the hotels that you're staying at this week, the restaurants that you're eating at, all of these people kept us going, and that was huge. The leadership team at my hospital, my chief nursing officer, Roseanne, our magnet director, Rhoda, my director, Patty. I have never seen the insides of any of their homes because they were on the front lines with me. They were on the floors with me, asking me what I needed to properly do my job. For challenges, I'd say the biggest challenge that we're facing right now is the other elephant in the room, that we're no longer in a pandemic, but we're in an infodemic as well. The spread of misinformation has definitely made things difficult for nurses. And we're in this really special and unique role where we're in a position to address those misconceptions and make sure that our patients can make informed decisions about their care. And also addressing misconceptions about nurses, right? We have a lot of people who are very supportive to nurses, but we also still have public figures who want to know why I, as a nurse, am wearing a doctor's stethoscope, what kinds of card games I play, and kind of refer to my career as a Halloween costume. And those are things that we need to address here in the United States and here in these fellow countries. I do think these challenges have driven a lot of nurses out of silence, and I do hope to see many more nurses speak up over this next year, and I hope that all of you will be a part of that as well.
Wow. Thank you, Amy. Thank you, Amy. And lastly, Dr. Anant, what do you have to share with us about your experience from India?
Thank you, Esther. So, first of all, I'd like to acknowledge the organizers for giving the prominence to community health workers by having a panel which is right in the middle of the session, sort of giving the importance. I'm also incredibly privileged to be sharing the stage with 3 nurses, a community health worker, a health journalist, and I think, again, your voices are extremely important. In terms of sort of reflecting on the pandemic, the one thing I do certainly want to say is that the pandemic has shown something to us which was well known to many of us, perhaps working in global health, which is that our health systems have been chronically underfunded, and the pandemic has shown us the underbelly of the health system by virtue of making it so difficult and resource constrained. And this is not a one-time event. This is literally decades of chronic underfunding and underinvestment in our health systems. And this includes frontline health workers, this includes community health workers. So I think if anything, we should learn from that. You know, I have friends, family who work in the health system, and one of the first things I've seen over the last 2.5 years is just how heroically they have all acted. You know, at a time when this was huge risk to themselves, there was not much known about the pandemic, there was not much known about the virus, that every single day they went to work. You know, this huge feeling of duty to care, even at the possibility of contracting COVID, dying, was something that, you know, they just kept on going, even with those risks, and that is something to really, you know, to acknowledge. And this was at a time when there was a shortage of PPE, there was sometimes situations, as was being mentioned on the panel, you didn't even have masks, or you had to reuse masks, etc. On top of that, you had inadequate compensation, you had situations where, you know, there were huge lines in emergency. I've had colleagues who could not get beds for their family members. There were doctors and nurses who unfortunately died because there was no oxygen available in their hospital. And these were individuals who got COVID as a part of their caregiving. So, you know, so of course, they in many ways have died, but also leave behind a story for all of us to remember about what needs to be done differently. Now, when I visualize community health workers, I see everyone in the chain, you know, right from the security who was manning the gate and trying to manage the crowds as the waves were hitting, all the way to all the kinds of paramedical staff who made themselves available, facilitated patient care. And so, of course, when we talk about community health workers, we should talk about everyone in the chain who's been involved. The second thing I want to talk about is the difficulty which many of health providers faced in practicing evidence-based medicine, because evidence was a question mark. We didn't really know most of the time what worked, what did not work. And on top of that, you had the politicization of usage of medicines, of vaccines, of evidence itself. So I think that is something we need to learn from and try to protect again in terms of the future. That, you know, we have to make sure that the way we practice our health is protected from external influences. It remains focused on evidence. The third thing I want to talk about is the pandemic has taken a huge toll. It continues to do so on the health and well-being of health professionals, and this is especially true of mental health. And we don't often talk about the huge burden it takes to take the kind of regular risks which were involved in the pandemic, to see colleagues get infected, die, to see patients die from sometimes simple things such as oxygen not being available. And we don't talk about the stigma associated with talking about your own struggles with mental health, which are there in the health profession. And so we, of course, also want to acknowledge that and work on that. And we also need to talk about the fact that many health professionals became the face of the health system. And because the health system was underfunded and did not have the resources, they unfortunately sometimes also faced violence from families who were trying to get care for their loved ones, but of course could not access care because there were deficiencies. There was also, unfortunately, and continues to be bullying in the health system, and community health workers often face that, and exploitation. And these are all issues which have existed before the pandemic, but perhaps have been accentuated during the pandemic. Finally, on a positive note, you know, despite all of the challenges, I think as societies have persevered, you know, 2.5 years into the pandemic, here we are at UNGA. We are all in person here, you know, thanks to all the community health workers who made vaccination possible, who've made societies survive, you know, perennial waves of the pandemic. So I don't want to end on that positive note that, you know, we need to celebrate all of the fabulous community health workers on this panel and the many more who across our countries have contributed so much for that.
Thank you very much, Dr. Anant. And now to Rashid. You have heard from the panel, we had the ministers here, we had many people here talking to you and talking about the health workers. How would you want them to support you, the health workers, in the short term and in the long term? Rashid.
Thank you for the question. There are a lot of things that I want readers to do to support healthcare workers. But the first one is I am kindly asking the political leaders to avoid politicizing the pandemics. Yeah, for example, in many African countries, we are having challenges in implementing COVID-19 activities because people in the community do not believe in COVID-19. What was happening is when the opposition leaders were telling the people in the community that the COVID-19 is not real because they want the elections to proceed. Now those leaders are into power. They are convincing the people to get vaccinated. Yeah, so it is very hard for us to healthcare workers to convince these people that COVID vaccine is real and is safe, while the leaders back then told them that the vaccine is not, COVID is not real. So I urge them not to politicize any pandemics to come. I also would like to kindly ask the policymakers to invest in community healthcare workers. We are struggling to implement community health activities because we do not have enough community healthcare workers in our settings. I would like also to ask these leaders to, consider providing houses for community healthcare workers. We want community healthcare workers to stay in their communities, but there are no houses for them, to live there. So this is very challenging for them to, to travel from where they live into the communities to implement their activity. We want also the community healthcare workers to have good access to transportation. A lot of community healthcare workers in my country are walking long distances in order to provide routine immunization with a cold chain in their hand. Some very few privileged have motorcycles, but they do not have enough fuel to use in their motorcycles. So it is very difficult for community healthcare workers to implement their activities in the communities. So I urge policymakers to invest in them and provide support to them. I would like also to ask political leaders to, not political leaders, but policymakers, to adequately provide healthcare workers with personal protective equipment in their, health interventions. We've seen a lot of nurses providing healthcare to COVID-19 patients without appropriate PPEs. So we've ended up losing a lot of healthcare workers because they did their job passionately without required equipment. In addition to that, it is also good to provide adequate infrastructures in the community for healthcare workers. In my country, we do a lot of community activities under the tree because we don't have designated structures in the community. Imagine giving a family planning service to a woman under a tree or in the church without privacy. So it is good for policymakers to consider this aspect and to address it with seriousness. I think I'm going to end there. Thank you.
Thank you, Rashid. And those sound like really basic things that Rashid is asking for from the leaders. Stop politicizing the pandemic. They want houses where they can sleep. They need transportation to their places of work. They need PPEs when they are doing their work. And those are basics. So kindly listen to them. Bupe, I'll ask the same question. What do you want? What sort of support do you want from the leaders?
Okay, so I think that is why I am here mainly. So I'll start with the short term. So number one, I would like the policymakers to ensure female community health workers are included in the decision-making process. And why is that? Because despite women making up 70% of the health workforce, only 25% are in leadership, and most are not paid or recognized. And also why I support this, like I said earlier, I work for Mothers to Mothers, and it is an organization that employs local women that are living with HIV, and this model has done wonders. We have reached over 15 million people across the African continent, and so if you include women community health workers, we are headed the right direction. And the second point, I would say on the long term, is to help us secure political commitments to recognize our status formally as the health cadre of health workers that we really are, and ensure that comes with fair pay. Fair pay should recognize the work we do and how complex it is, the number of hours, and the training we need. And also, we need strong supervision and training. For me, this is personal. Where I come from, my manager gives me the support I need, and it has helped me learn so much and be able to do my job well. And another thing I would say is we need that money. I mean, for me, without my salary, I wouldn't be able to provide for my daughter. I am a single mom, and with that same salary I am getting, I've been able to start building my own home, and also I will be soon furthering my studies in social work and community development. So I'm advocating to say we really need to be paid and recognized.
Thank you, Bupe. The salaries indeed need to come, and yeah, everybody needs to develop themselves. Nobody wants to work for free. Nobody works for free. Daren, what do you want to say about supporting it?
I have three main points, but before I discuss those points, I'm actually quite disappointed that the audience, they should be here listening to us. I am really disappointed. The first one is, although we are considered heroes, during this pandemic, we will not be able to sustain the response or the COVID-19 response without, of course, proper wages or just wages, without adequate staffing, and without livable conditions. And I know beyond this compensation and benefits, it has to be holistic as well. So when I say holistic, we need to have protections. I know one of the colleague earlier asked a question about protections. We need that. And we also need mental and emotional support. We are also suffering from depression. We are also suffering from all those mental health conditions. So we need that. It has to be holistic. And then my second point is, if you are investing in universal health coverage and also primary health care, you should also invest in us, nurses. Let me tell you 2 good points why. We are the biggest or the largest contingent of global health workforce in the world. We account to 80% of the contact between nurses, between healthcare workers and also the patients. So, if you are gonna implement universal health coverage, you just need to tap us. Job done. That's easy, And then my second point is, as I've said earlier, we are the largest, so our strength is our number. So, from both the quantitative and also the qualitative standpoint, those countries who invest in nurses, they are the one who's gonna be rapidly and also cost-effectively fulfilling the promise of health for all. So those are just 2 reasons. I can give you 100 reasons why you have to invest in nurses. And then the third one is, probably you are investing a lot more in Africa. And I just wanna highlight that please don't forget Asia and Pacific. I know there's someone from India here. I am from the Philippines, but I'm quite sad that I don't see any panelists from the Pacific. So we are being left behind. Thank you.
Are there people from Asia here? Kindly wave to Daren so he's assured.
I don't see any hands.
Okay. And Amy, could you kindly tell us what sort of support you would like in the short term and in the long term?
We've heard from a lot of really great leaders here today, the ones that are up here right now, the ones that were here earlier, but I bet there's a lot more. So if you guys don't mind, if you consider yourself a leader, whether it's in your profession or your personal life, just raise your hand just so I can gauge who we have here. So there's quite a few of you. So I would actually say to all of you and to the leaders of our countries what I say to all of my patients when we're in a rapid response. So for those of you that don't know what that is, a rapid response is basically a medical emergency. It's not a code. Your patient's still breathing. They still have a pulse, but things are going downhill really fast and you need to act rapidly. So whenever we have a rapid response, I'm usually putting in IVs, drawing blood, doing an EKG, things like that. But I always take a minute because as a nurse, I don't just treat illnesses and diseases and emergencies, right? I treat human beings and patients too. So I always take a minute and I look at my patient and I say, right now you are surrounded by the best doctors and nurses in New York City. You couldn't be in a safer place. And we're going to do everything that we can. And that last part is really important because when you say in a hospital that you're going to do everything that you can, you have to mean it. So now I would say to all of you, right now you are surrounded by some of the most resourceful, impactful, brilliant human beings that I know. You could not be in a better place than you are right now. And while we're trying to do everything that we can, we still need to do more. So what do we need to do? We need to bring nurses into these conversations where decisions are taking place. We need to build bigger tables. We need to pull up chairs for these nurses. We need to hear from the nurses in New York City that have seen the insides of more refrigerator trucks than your local grocery stores. We need to hear from colleagues like Daren's who have been forced to reuse PPE. And we need to hear from the nurses who had to use bandanas as masks because they did not have anything else. They were leaders of this pandemic on a local scale, and now we need to bring them into the global level. Our countries, all of these countries, are in a rapid response right now. And we all need to clock in before the entire healthcare profession clocks out. So my leaders, if you're willing to clock in with us, I would just ask you to raise your hand, please. Thank you.
Thank you very much, Amy. That's really encouraging. Everybody has put up their hand. And lastly, Dr. Anant, we are running short of time.
Sure, Esther. So, what I expect is respect. And, all of us who are professionals know there are a few elements of being respected in your workplace. One is, of course, fair pay, but pay also which is given on time. Many of our health workers have talked about 6-month delays, 8-month delays in getting your payments. And of course, you can get all that money, but what do you do for 8 months in the interim? So that is extremely important. The second thing is supportive supervision. I think that is true of any professional, but especially so in health, it's extremely important, and we don't sometimes see mechanisms for that, and we should be doing more about that. There is a reason in global health why we've shifted from a task shifting approach to a task sharing approach, because we recognize that there is a partnership, there needs to be a referral mechanism, there needs to be support from the health system. You don't just outsource activities to community health workers and say, now it's your problem to try to respond to community health needs. You work with them and you support them in delivering the kind of care which communities deserve. So that, I think, is important. We do a lot of work with ASHAs in our organization. ASHAs are 1 million strong, a huge community health workforce in India. We train them to provide psychosocial care to communities. And many of them came back to us and said, it's excellent that you're working with us to deliver psychosocial care for communities, but why doesn't anyone think of us? What about our own mental health and well-being? The fact that there are personal demands from families, from communities, from the health system, which comes up with a new laundry list of demands of activities that we need to keep giving, yet not giving us payment on time, yet not having career pathways for us. So I think when we devise responses, we should also think of what health workers need and how do we invest in that and promote them in a way that they can actually meaningfully respond. Finally, I also want to say to leaders that the response often is one on trying to do cost saving, and one way of doing that is putting in contract mechanisms, in not regularizing workforce, and I see that as a huge impediment to making health systems resilient. So when we invest in health workers, let's not do it with a mechanism where they're exploited, where they're not given fair pay, where they're not given a career pathway, where there is a certain stability. The model not to use is one which is based on let's just outsource, let's do contracting. Think about that from a more meaningful long-term perspective. Thank you so much.
Thank you. Thank you, Dr. Anant. Indeed, when we invest in health workers, we make the health systems more resilient. I'll take one or two questions and we close up. Any questions from anyone? Okay, yeah, we have some questions.
Thank you so much. This was an incredible panel, and I echo you. I was disappointed that half the audience left after the leaders, quote unquote, left the room when they should have also stayed here to listen to you. But thank you. We're honored by your presence. So one thing I'm very curious about, I think both so many of the patients you're seeing, and women and girls especially like you, are also clamoring for respect and dignity in terms of how they're treated. I'm really curious how you see being able to work in concert with your patients to almost sort of co-advocate together upwards for larger change, because I think it is such an interesting respect cycle that exists, and you are deserving of dignity and respect, and so are so many women and girls. And I'm just curious, how can we kind of break down sometimes the tensions that exist between patients and providers in that, and really like unite on the same side to really advocate together to change the system? So I'd love your thoughts on that.
Sure. So thanks for the question. This is a huge issue, and I think in many health systems, the lack of respectful maternity care, for example, and I think it's increasingly being recognized, being written about, and I think it's hugely important. We do a lot of work also with marginalized communities, transgender community members, persons with disability, and the way we have tried to respond is actually co-produce learning mechanisms by involving persons with lived experience. They are as much experts as anyone else. For us, that is the kind of expertise we need to bring into our medical schools, into our nursing schools, into our paramedical schools. It's not just patients in the wards, it's patients coming to your teaching classes and talking about their experiences, both positive and negative. In drafting competencies for how health providers need to be doing things differently, it's important that those inputs are part of the process. And we've started doing that, at least in some ways, with marginalized communities. I would tend to think that co-producing knowledge and the way we visualize health systems by having patients as an integral part would be a huge part of that.
Thank you. You wanna?
I was just gonna say, I think that here in the United States, too, it's important that you have both patient-centered care and also nurse-centered care. We have to care for everybody, and it's important also to make your patients feel like they're not just another dollar flowing through the American healthcare system.
Mm-hmm. The second question.
Thank you. Hi, everyone. I'm Carrie Westgate with the Community Health Impact Coalition, and I just want to extend a big thank you to the panelists today. It was great to hear your perspective. My question is directed, I think, to Rashid and Bupe. I just wanted to know, I think this is both of your first time leaving your country and being here and advocating and sharing your testimony here. Just what does that mean to you? Just in your own words, can you tell us a little bit about what this opportunity means to you and what you'd like to share with other community health workers or nurses in your countries?
Thank you so much. For me, what this means, is that our work is being recognized, not just in our country, but everywhere as community health workers, because everyone has gathered here for the same cause, and we are here and we are speaking one voice, and that's one thing I will take back home. Our work is being recognized globally.
Yeah, and as for me, I've been doing my advocacy activities in my local communities. I speak about my activities only in my country. No one beyond that has ever heard what I do, except for Vince and other colleagues. So being here, I think it is a big platform for me to, relay the messages, what the challenges that healthcare workers are facing. In that way, I think I can be able to reach out to a lot of political leaders or policymakers that can help in addressing the challenges that we face in many African countries, including Malawi. So this is a big platform for me, to attract the attention of policymakers and those who have the capacity to help community care workers and all other healthcare workers. Thank you.
Thank you very much, Sabine, for bringing all these health workers here. And one more question. We are running, no, we don't have time. I'm sorry, you approach them. Thank you, Dr. Anant from India. Thank you, Amy from New York. Thank you, Rashid from Malawi. Thank you, Bupe from Zambia. And thank you, Daren from the Philippines. We are really grateful for the work you're doing, for saving lives. Please clap for these people.